It is thus surprising and proud that Bangkok Hospital is the Thai hospital with numerous branches in ASEAN region. And now their arms are open for intercity international aids not only in ASEAN. So let's hear now from Bangkok Hospital CEO Dr. Chatree Duangnet.
Welcome to Toward 2015. Today on the topic of the AEC 2015, we are going to talk to one of the significant medical practitioner who's a vice president of the Bangkok Duangnet Medical Service, who is going to talk to us about his perspective of the ASEAN economic community. สวัสดีครับ Dr. Chatree.
สวัสดีครับ สวัสดีครับ
Okay, so you are Dr. Chatree Duangnet, and today I would like to ask for your opinions and perspective on the coming trade barrier elimination of the region here in ASEAN. Okay, so what is your perspective of 2015 for medical industry?
First of all, our company perspective on the trade barrier lifting of the AEC 2015, we think it's going to be a very slow process. It's not going to be just like in 1 week, then
right.
we see everything just boom in front of your face.
Okay.
Actually, lots of things have changed already right now, gearing to that. So, in our perspective, the effect going to be slow, and the effect that will affect to our company is going to be not significant because we have been preparing for that since 2 years ago.
Okay.
For that event that's going to happen to us. The perspective to Thailand as a whole country, we're going to see some of the, when the barrier lift, I would say good water from one side will flow to another side, depending on how well you prepare for this change.
Okay, so as an executive of a famous hospital here in Thailand, what strengths and weaknesses does Thailand in general in terms of medical industry, what do we have?
Our strength would be the standard of healthcare of Thailand in general. It's pretty good.
All right.
Comparing to Singapore, Malaysia, and India. Our strength number 2 would be Thailand is a preferred place for people to come and visit and to live. If say we are a doctor from some other country, would love to come and live here and practice here, and
right.
Also prefer for patients to flow freely to our place also because of Thai hospitality and service standard. And standard of living is not that high comparing to some of the country. Our weakness would be, I would worry more of our weakness of our country here is going to be environment. Number 2 would be infrastructure of technology. Number 3, education. And number 4, social standard overall. However, when the barrier is lifted, I feel that all those weaknesses going to get better because of we can learn, can bring all those the know-how from the other countries that is more advanced than us, like Singapore,
sure.
or sometime Malaysia, to come and then can lift all those weaknesses.
Okay, so we're just talking about the strengths and weaknesses in general.
Yes.
So what about your hospital? How are you bracing for the impact of 2015?
Yes, our company, since we are the largest network hospitals in Thailand and actually in Southeast Asia,
okay,
in ASEAN.
How many hospitals do you have?
We have right now 29 hospitals.
29.
And with 5,000 private beds, with market share of number 1 of listed companies
okay.
in ASEAN. So we are that big. So our strength in the AEC would be pretty strong. The risk of us being acquired by somebody else is going to be very little because we are so big.
Okay.
And With that, we also are very caring about standard of care. We have 11 hospitals in our 29 hospitals that are taking care of international patients, and all those we have them pass Joint Commission International, is the American standard of care. And with that, I think we have been prepared. On top of the size and quality, we've been preparing our personnel, which we think is to be the most important factor of AEC, personnel. So we have collected great numbers of great Thai doctors.
Okay.
Good doctors. Number two, good nurses. We have been collected very good, skillful nurses, and with lots of training.
Right.
Number three, good service overall. We try to do service just like 5-star hotels. And number four, good technologies. We acquired all technologies in the world that need to provide to patients at our group here. And the last one would be, we have been setting up a very good referral system to make sure the globalization of patient to us and back home 360 degree is very smooth. So we have been preparing for that.
Okay. So on my way here before the interview, I noticed a lot of international patients, more than the other hospitals I've walked into. So can you please elaborate to me a little bit about how can you attract a lot of foreigners to be coming to the hospital?
Yes, it's our lucky. We are lucky in terms of standard of care of healthcare in Thailand is very high. We, after talking about good doctor, good nurse, good service, good technology,
yes.
After we doing that, we have been telling international patients that we have all this. Our quality of care is really internationally acceptable, just like any advanced countries. Right. And on top of that, we add on Thai hospitalities.
Sure.
And that's something very unique that no other countries can provide. And number three is we have Thai pricing. Even though it's a little bit expensive than India and up to par to Malaysia, but add on to Thai hospitality, they prefer to come to us. And last but not least, Thailand is a destination for tourism, for family, everything, they want to come here. So that's why, as a result, 31% of our income now are from patients flying in from around the world. Number one country would be Myanmar. And then number two, UAE, number three, Qatar, number four, Ethiopia.
Okay.
And then Bangladesh and Europe after that.
Welcome back, and now Dr. Chatree Duangnet reveals more information confirming Bangkok Hospital's outstanding operation and employee management, as well as cutting-edge technology proficiency that it provides.
Okay, and how it surprises me that many international patients are willing to fly all the way here to buy the premium quality that the Thai hospitals has to offer. So how do you get your message across to these, your target groups?
Actually it's a word of mouth.
Mostly word of mouth.
Right. And then we add on, as I mentioned to you, that 360-degree referral system. We have our agent in here and in each country to make sure the coordination of patient referral from home to here, go back home. We call door to door and back to door. It's very smooth. Okay. And that's the reason why they all like to come here.
Okay, and what about the quality and assurance? You mentioned about the JCI. Can you elaborate more on that?
Yes, we are very strict. My background myself, 21 in the US, I was working on quality and patient safety.
Yes.
So they hired me here to make sure we set up the same standard here. So we are very, very strict on patient safety. and quality of patient care. So that's why we have chosen JCI, because Joint Commission International really strictly focus on patient quality and safety, and we tracer, meaning we check every week on all 11 hospitals that pass JCI, and we have a corporate team that go around and look around, make sure they never let their guards down.
Okay. Do patients really look for that kind of certification?
Yes.
Before they choose?
Right. International patient, before they come here, is almost a leap of faith.
Okay.
So you have to make sure they come here. They get quality and they're safe for their life. They do. Unless they have been here before, they don't have no other way for them to make decision unless they see that certificate. But after they touch our care already, I think after that it's word of mouth. They come back without checking that. But the first time is very important.
Okay. So what about, we've talked about the patients, and now let's look at from the practitioners themselves. How about their movement in this AEC environment? You know, the mobility of the workers will be more flexible.
Yes.
So what about the medical doctors and nurses? How would you see from that?
Just on the level of our company, we've been doing a lots of management to make sure all doctors, nurses, all service people, they're all happy with our hospital in the network, all 29 hospitals. We call it pooling effect. Pooling effect. We have been creating that 2 years ago, and we're going to keep doing it until we pass year 2015, including they pay because of quality. They have the career path for them.
Okay.
They know what's going to happen in the future. We call stay and strive. All
stay
those,
and strive.
Yes, they want to say something. They want to stay and they want to strive to grow in our organization. And we call employee engagement to check all those.
Okay. How does that work?
Yeah, we will check them once a year. All kinds of questions to make. There are 21 questions to check for their engagement, how much they want to say about.
Okay, like a survey.
Right, a survey, and the score, the average score is around 58%. We have made that. Some starting not so good and some very good. We keep doing that to make sure that we have pooling factor for our people. So whenever AEC opens, we want to have the pooling effect. We don't want to lose our employees. Thailand as a whole, we are not sure, but in our company, we have been working very hard to have the pooling effect.
Okay, talking about the pooling effect, just now, how much are we talking about? Do we expect to see Singaporean doctors or nurses even more in 2015 and beyond? And probably Thai medical practitioners go abroad to Cambodia or Vietnam? Is that what you're saying?
Yes, because they can, supposedly, I'm not sure, and I still confirm that this can be very slow.
Okay.
Supposedly they can go practice anywhere in ASEAN countries.
Yes.
We would love to see people come in, doctors come in more than doctors going out in the future in our country, and especially for our own company. Right now we start seeing pool effect from hospital outside of our network already. And lots of doctors abroad want to come work here. There's still lots of barrier. I think when we lift that, I think lots of doctors want to come and live in Thailand. Even though the income can be less than staying in Singapore, but the cost of living is much less, and then things are much more pleasant. This is personal feeling. Maybe it's not scientific.
Okay. And what about the push factors? Are there any negativity, by having the AEC in 2015? Would you be having a lot of people from Thailand going out to other countries?
I do not see much of push factors in the country except for environment, like I mentioned to you, discipline of people, socio-economy, which I don't think that's a main factor. I am afraid of pooling factor is stronger than the other country, like payment for professionals is much higher in Singapore and Malaysia.
All right.
However, with maybe it could be neutralized by a living condition, meaning not that they're bad, then they're worse than us, but living condition in more of the Thai hospitality environment, something like that could neutralize it. Nurses, we do not feel we worry much about nurses because the Philippines has been providing nurses for all over the world. They have so many nurse graduates yearly that it's more than any. They have been feeding to all the countries.
Of course.
So if we can have nursing come here freely, we can easily take it from other countries.
Okay.
The rest I see not much problem at all.
Okay, and now we've talked about the people, and what about the goods themselves, the medical supplies? Will they be getting cheaper because of the tariff being eliminated? Do we import a lot of stuff, the really heavy machines that you use for operations and all that?
Right.
So do we see that being a less obstacle to the medical industry?
Yes, you are right on that. Since the tariffs can be less, medical supplies, equipment is going to be less expensive.
Yes.
But on top of that, our company has a daughter company called N Health. They're doing all kind of procurement and lab and all logistics.
All right.
Logistics with that company gonna grow very fast because they can do now. They can not only they can do in Thailand, they can always do it some other countries in ASEAN also. So I think that can be plus factors for us.
Okay. And last but not least, how do you view AEC in general? So is there more benefits than the losses for Thailand?
AEC is a dream come true. With 600 million people, AEC is a pretty girl that everybody want to court.
A pretty girl.
Right. And after looking at EU, what happened to EU now and before, I still think overall AEC is a great thing that will happen to all of our countries. At least some other part of the world will start looking at us with more importance in their eyes, which you can see that already.
Yes.
It's how we can get into that with a culture of ASEAN people and with lots of barriers. It's going to be slower, but overall, I still feel it's going to be for the goodness of all the people who live here, and we should be proud of it.
Okay, well, thank you very much, Dr. Chatree, for your share of information for today. It's very helpful, and I hope that your hospitals will gain reputation and that we should see more involvement in ASEAN.
Thank you very much.
Thank you.